Welcome to the Confident Retirement Podcast. Is doing the most important things alone a good idea? How comfy are you with your choices when it comes to life's biggest decisions? What is real peace of mind with financial confidence, and how can you get it? Kris Flammang and Mark Peachy are the founders of LPF Advisors in Sarasota, Florida. On the show, they bring together the best and brightest minds to share with you how to have a more confident financial picture. They empower listeners with simple, common sense and financial wisdom. And now, here are your hosts from LPF Advisors.
So I want to welcome everybody to the Confident Retirement Podcast, brought to you by LPF Advisors. I am your host, Kris Flammang. And today I have the pleasure of welcoming Lester Morales to the show. He's the founder and CEO of Next Impact, an insurance consultancy challenging the status quo in human capital and employee benefits. Lester, thanks for being here and welcome to the show.
Kris, I appreciate it. I'm excited and I love these conversations.
Yeah, we're going to have a good time. So I'm sure you have an interesting history, like a business history. So I'd like you to take me through that and what led you to opening your own company.
So, nobody ever wakes up in the morning and says, you know what, I want to be an insurance professional, right? It's not like, well, top of list. You don't dress up as an insurance professional and you're 5 years old on career day. My story starts, so I was born in San Juan, Puerto Rico. My parents moved us to the States when I was 3 years old. I always say that we were chasing the American dream as much as Puerto Rico is part of the United States. Back then, they were running commercials on Eastern Airlines. If you remember Eastern Airlines, do you want to double your pay? Move to Orlando. So my parents were like, we're out of here. Let's go do that. Normal middle-class childhood. I very much identify as an immigrant, although I don't know if that's the right definition of it since we're part of the U.S. and Puerto Rico. But hardworking parents, multiple shifts, working the nights, all of that stuff. And the reality of it is normal, played baseball, was, a bus patrol, had friends, played hide and seek until 15 years old. My dad was diagnosed with multiple myeloma. So multiple myeloma, for those people that don't know, is cancer of your bone marrow. So bone marrow transplant, chemo, radiation, hundreds of thousands of dollars in medical expenses. And my parents, who both had jobs, who both had insurance, couldn't afford it. What family has a $5,000, a $10,000, a $15,000 nest egg every single year? And my dad was on a single drug called Revlimid that he would have been on for the rest of his life. So my parents filed bankruptcy when I was 17 years old. And, I don't have to tell you as a, junior in high school, how not cool, that would have been. And so that kind of started my career off, at least my notion of, wait a second, I don't really understand this. You have health insurance to kind of protect you. We had to file bankruptcy. And so when I went away to college, Florida State University, where I went to college, had a risk management insurance program. So I kind of felt like the universe, the Lord was, shutting me in that direction. And so I got my degree, which I'm a very rare breed that I actually do what my degree is in.
Yeah, that is rare.
Yeah, and especially insurance, right? And again, not a very cool thing to say. So that started everything. So I've been in this business my entire career, and I have had a very successful career. And when I was in 2014, so I had a personal production. So I was in personal sales, did really well, top 3 rep for 10 years. And then I got promoted and I was the chief growth officer for North America. So I had 200 salespeople that worked for me. We were a $350 million practice. And in 2014, my favorite person in this world, my mother, was diagnosed with pancreatic cancer. And if anybody ever wants to have the scare of your life, Google the statistics around pancreatic cancer. And so mom fought her tail off for 3 years, but unfortunately in 2017, she passed. And so, with both of my parents, I got to see the good and the bad of the healthcare system. And my mom told me when she got diagnosed that there was one thing that she wanted me to always remember, and it was to bet on me. And, when you work in a big, giant organization and you're trying to be this innovative person and it's like moving the Titanic, you can't do it. And so I literally, although I was the second in command, I was only 35 at the time, I jumped ship. I said, you know what, if I don't do it now, and what I have just seen with the two people that, created me is that tomorrow is not guaranteed. And that if you're going to make an impact on this world, you better go do it. So that's what started the entrepreneurial journey was my experience with personally dealing with healthcare and the nudge from my mom.
So what do you think is Next Impact's purpose? Not really the vision of the business, but what's the purpose? What do you feel like is the purpose?
Yeah, 100%. This is clear as day. 67% of all personal bankruptcies are because of health reasons. And so this is all about education to consumers, employees of employers, that the cost and quality of healthcare changes depending on where you go. If you go to the hospital for an MRI, you're going to pay $3,000. If you go down the street to the local imaging center, it's going to be $600. But Dr. Jones is different in his quality scores than Dr. Smith. But who stops and thinks about that? So, our purpose is simply that the design of the current healthcare system, people say it's broken. I'm not going to say it's broken. I'm going to say it's designed perfectly for everybody to benefit, but the consumer. And if, you look at that, do insurance companies make more or less money when premiums go up? Does a hospital make more or less money when they fill beds? Does a doc make more or less money when people come see them? Like, we have a healthcare system that is designed to keep people sick, unfortunately. And we have taught somebody never to think about being a consumer, just listen to the person. But we shop the heck out of the car that's in the driveway. We know exactly how much that car is in a square mile. I might drive 2 hours to go save $3,000 on a car. Right. But do I even stop and think about what my next surgery is going to cost? So that vision is simply just to educate employers and their employees that there is another way of doing it, but it just takes, one, the exposure of the information, and two, it takes us being consumers like we are in every other facet of our life.
Okay. And what type of companies do you find that you typically can help the most?
Yeah, so I would say 50 employees and up is typically where that threshold is. And really, it's a lot of times that, if there's a business owner or a VP of HR or CFO or somebody that's listening who gets fired up about hearing this, right? Who says, you know what, I'm tired of that same old crap too. That's usually the client that raises their hand because, again, it's not the status quo, right? It's not, hey, go do this same old widget and do the same thing that you've been doing for the last decade. It is, hey, stop and think, employee. Call this advocate. This advocate has cost and quality data, and they're going to help you navigate the healthcare system. So it's that business owner, that HR professional that is tired of the status quo and wants more and wants to demand more from something that is typically an employer's second largest expense.
Mm-hmm. So, and what areas of benefits planning right now do you think are getting the most attention? There's like hot buttons all the time.
Yeah, in the health insurance world, health insurance is by far the biggest, right? Because it's the dollar bill, right? Mm-hmm. If you look at an employer's top expenditures, salary is going to be one, benefits is going to be two. And of that benefit spend, healthcare is, 75, 80% of that, right? So it's definitely going to be healthcare. And you're seeing a lot of things right now, whether it's politically driven, right? These transparency things that are coming out of Washington about trying to force some price transparency. You would be blown away to see the price disparity of the same service at the 4 hospitals in any given city. We're talking thousands of percentage points difference in cost and with no correlation of the quality. So normally when I buy a nicer house, I'm expecting to pay more money. But a lot of times in healthcare, if I go to the very best person, they're typically a specialist. And what does a specialist mean? They do a lot of it. They do it very quickly. They're very efficient of it. Their staff knows that stuff. They buy more equipment there. So healthcare, unlike other things, actually has an inverse relationship a lot of times between cost and quality, that the higher the quality, the lower the cost. And so that is getting a lot of attention from a transparency standpoint. And, whether we call it, Obamacare or Trump care or, Biden care or, whatever it's going to be, the government's always going to be sniffing around something that is going to be healthcare related for sure.
Mm-hmm. Okay. So you say on your website, you kind of help companies to break free from the old way of approaching benefits. So how specifically or generally do you guys do that?
Yeah, no, it's very intentional. So if you think about it, you've worked at a company, you own a business, right? Think about what you do every year. I buy my health insurance every year. I'm expecting it to go up. It comes out at 15%. My insurance broker, sends it out to market and negotiates that to the same five cast of characters that's been doing it for the last decade. Kris, what does your insurance company call your premium? Revenue.
Oh, okay. Gotcha.
Right?
Yeah,
so think about that. Do you wake up in the morning wanting to lower your company's revenue? So when you think about that, it's like, wait a second, the person who I have 100% trust or expectation that they're going to help me control my costs is actually a lot of times a publicly traded company who has shareholders that they need to deliver shareholder value. And so every year your costs go up. It starts at a number. Somebody helps you negotiate that down. We typically come back in a room that's typically the highest wage earners in the company, right? A CEO, a CFO, HR people, and say, man, if we just increase that deductible by another $1,000 or tweak that copay higher or whatever, we can get that cost basis down. We'll add a couple more bucks out of everybody's paycheck every year. And that's how we've handled healthcare since the existence of healthcare. And so what we do is that we show, one, it's all about data. So step number one is ensuring that client understands that their particular data. So a lot of smaller companies don't have access to their data. We have tools that allows us to scrape data off of websites that show that you went to Dr. Jones and how much did you pay, so that we can understand, well, wait a second. First of all, if that 15% renewal, is it fair? 9.5 times out of 10, back to the what you call premium, they call revenue. No, it's not fair. They're trying to make a profit. And so it starts with the data, and then it goes with the notion that there are a few things that people can do differently. So what we like to do is design door A and door B. Door A is employees do exactly what you were doing last year. Dr. Jones, go to Dr. Jones, don't call anybody, don't do anything different. You pay the same exact thing that you did last year. Door B is, but if you're okay to pick up the phone and work with the advocate might be a concierge, might be a nurse, depending on how we structure it with different companies that we partner with. If you're willing to go and talk to them, they're going to make a recommendation on where you go access healthcare. If you go there, everything is free. And so you've got a choice, just like I do in every other consumer-based product and good and service that I consume. And one choice is just navigated based on the information that's available, but it's not available from the major insurance companies because, again, do they want to lower your cost or do they not want to? And I hate saying it like that. I'm a conspiracy theory, but at the end of the day, we have to just understand how economically companies are motivated and incentivized. And unfortunately, this is an industry that is completely misaligned in its incentives.
Yeah. So that leads me to a question then. Maybe you could share an experience about a business that you worked with where you made a huge impact. So not sharing personal information, but take me through kind of one of your case studies and how you were able to help.
Yeah. Every Friday morning, I have a team call and I just showed my team because I want people to be fired up that work for me, not because that they work for me, but because of the mission of what we're doing. Like, this and walk people through how each member of the team had something to do with this. But it's a 500 life employer headquartered in Atlanta. They're getting a $600,000 increase in cost. So I take all of their data. I understand what prescriptions people are taking. I understand where they're accessing healthcare. I know what the plan paid for that same healthcare. And so we do a couple of analysis that says, first, prescription drugs, biggest shell game there is in the world. I mean, I cannot tell you how easy it is to save companies 40, 50% on their drug cost just by bringing transparency into the mix. So in this particular client, there was a total of a 38% savings just in their prescription drugs. And that's not changing anybody's prescription. It's not changing anybody's CVS pharmacy that they went to. It is the same drug, the same person got the same medication at the same pharmacy. It's just taking that spread of what typically a pharmacy benefit manager, a nerd talk, but a PBM, their whole job is to buy low and sell high. I buy it from the manufacturer for $1. I sell it to the insurance for $10, and they make that money in between. So that's step one. Now, the greatest part about that is another portion of that pharmacy is the expensive drugs. Those drugs that you see at 8 o'clock at night when you're trying to have dinner with your family, right? Let's take Humira. Humira will sell $29 billion with a B dollars this year in one medication. That medication has a patient assistance program. There's 3 qualifications for the patient assistance program. Must be a U.S. citizen, cannot be on Medicare or Medicaid, and a family of 4 household income has to be less than, I think the last number I saw, about $157,000 a year. So Kris, you're a financially astute guy. What percentage of working Americans make a household income of less than $157,000?
Very high.
Very high.
90% probably.
You got it. You got it, right? And so, well, wait a second. This patient assistance program exists where now if somebody qualifies, the drug is now given to that patient for free and the employer doesn't have to pay it through their insurance. But why don't people tell you this? So this single drug is what made my family bankrupt, because Revlimid, who also has a patient assistance program that my parents, who made a household income of $92,000 a year, would have absolutely qualified for. So right then and there, there's $500,000 of savings in medication that you're not asking anybody to take a different drug. You're not asking them to not take their drug. You're actually incentivizing them to participate in these programs. And if they do, their drug is now free. And the client saves $500,000 in drugs like that. So that was just the pharmacy side. The medical side, what we do is we look to say, well, how many MRIs occurred at a hospital when it could have occurred at an imaging center? How many surgeries occurred at a hospital when it could have gone to an ambulatory surgery center that only does surgeries? So like a knee surgery, for example, I had knee surgery in 2010. My knee surgery at the hospital cost $90,000 of bill charges. Then the insurance company gets their big discount, right? And now that discount comes back and it was $45,000. I paid my $5,000. The plan, the insurance paid $40,000. I now know that 1.2 miles away from that same hospital, there's a place that is called South Tampa Orthopedic. Hence the name, they only do orthopedics. They're a specialist. They will do that same surgery for $20,000. So in the types of plans that we help employers produce, the plan would pick up that $20,000 and eat the $5,000 that the patient paid, $25,000 versus the $40,000 that the plan picked up over there. And we just got somebody to a higher quality place who is a specialist in what they do. The patient didn't pay that $5,000 and the plan, the employer, saved $15,000. And that's all day long, every day. But what does that take? It takes the employer willing to stand up to the status quo. And it takes the patient, the consumer, to take a little bit more action and pick up the phone and talk to a nurse who is going to help them navigate the system.
Yeah, to educate them on what their options are, because they don't know what they don't know, right? Okay.
100%. Like, just like we didn't know how much how bad we were getting hosed when we bought a car without going in there educated. Now there are consumer-based, sites and information that's out there with the involvement of the internet, right?
Yeah.
That we have all that information. That information is there in healthcare. They just make it super hard to get to and you don't understand it. So that's why we put these advocacy type platforms in place to give that employee, that member, that patient, somebody that they could go to and just pick up the phone and get educated.
Yeah. Yeah, there's so many things like that there in society where if there was an advocate for people, it would make a huge difference in the choices they would make and how much they would spend on those things. So what are you liking especially about your business right now, Lester?
It's funny. I ended my meeting this morning with my team on, you get up every day, you look at your to-do lists and you look at them as a task. I got to send this email. I got to prep for this meeting. I got to pull this report. I got to call this client back. And what we forget is the human element of this. So when you pull that report and you see that these 7 people got redirected, put yourselves in their shoes. That's a family that just probably saved $3,000 to $5,000 on one procedure. That's a family that didn't have to make a decision on whether they made their mortgage payment or gave Sally the new pair of shoes or whatever. So there's a book right now that I really advise everybody to read, Marshall Allen, and it is Never Pay the First Bill. And it basically talks about the healthcare system and its inadequacies. And the reality of it is you get this bill and you're so worried about that bill is wrong 95% of the time. And so there's stats about 140 million people are in debt. I forget exactly the number, but what boggled my mind is that the average human being who is in debt in the United States is in debt for $486. So what does that tell us? That tells us that the average person who's going to consume healthcare doesn't have $500 in the bank to take care of that. They're literally having to make purchasing decisions based on their own health and their ability to run their family, pay their bills, eat, et cetera, et cetera. And then as employers, the industry has failed employers because we've brainwashed you to think that it's completely normal to just pay a 10% increase every single year. And the way you approach it is just to increase the deductible even more and then take a little bit more out of their paycheck. So you're giving them a crappier plan for more money. And that's year over year over year over year since the existence of insurance. And we've accepted that. And so my favorite thing about what I get to do is, and it's hard because, like they say, nobody ever got fired for hiring IBM. Nobody ever got fired for hiring Blue Cross, right? That logo has such a brand equity on it. And they think that, oh man, they've got my best interest in heart. And I'm not picking on Blue Cross. I'm just saying the realities of how they're compensated, premium revenue. So my favorite thing, Kris, your question is, I get to help people. I get to help people who I've been in that shoe. I've seen my parents have to make tough decisions. I've seen the fact that they were giving me $250 a month out of my dad's disability policy. I've seen, oh, wow, we were only getting told what's happening in Tampa, Florida, but what if there's a specialist in Oklahoma that does that? But why would the guy in Tampa, Florida, who works for the hospital, who only makes money if that stays in that hospital, why would they tell me that there's a pancreatic specialist there? And maybe at the end of the day, 3% of people live longer than 5% with pancreatic cancer. But at that point, I'll tell you right now, Kris, I would die. I would give anything for another week with mom.
Yeah.
So when I think about that, I get to build something and deliver a plan that saves people money and impacts lives. And impact, the word impact is very, very purposefully chosen.
Then what would you say, Lester, is probably your biggest life accomplishment? Is it what you've accomplished with the business, or is it something else?
What a good question. I don't think it's the business. If I were to look at myself in the mirror and say, you did good, kid, it would be, by age 40, I've lost both my parents. In 2007, I lost my mom in August 11th. I live in Puerto Rico again, and Hurricane Maria devastated our island. I had 3 feet of water in the house, 37 windows in my corporate office building blew out. I had employees that lost everything. My business partners and I at the time broke up. That cost me several 7 figures in dollars. And I started this business in February of the next year and haven't looked back. So I get a lot of people to be like, I don't know how you did it. And I don't know how I wouldn't have done it because I don't know any other way, right? Like I was taught, in a very tough love family. Like I've always felt love in our family, but it's not we sit at the dinner table and ask about how your day was going. It's you showed me love and tough love at that. Like, hey, you look like crap on the pitching mound, or get inside and clean your room, and you get a spanking every once in a while. I mean, in my generation, in my household, right? That was love because they were teaching you stay in the lines, do the right things. And so I think for me, I didn't know any better other than to brush yourself off and keep going. But when I allow myself, and as I get more and more into personal and professional development, I try to schedule times to reflect and give myself those attaboys, because I'm not somebody that does that enough. I would say that I need to be proud of the adversity that I have had in my life, and that the fact I still wake up. And as you can tell, I'm a very fired up individual. I'm very passionate about what I do. And I was making way more money not being an entrepreneur, being a W-2 employee for somebody else than I am now. But I'm just, I'm passionate about what I do. I'm passionate about being a provider for other people and being a giver. So the overcoming of those obstacles, I think, is what I would say.
Yeah. And I think it's obvious, you know this as well as I do, that the money doesn't ever equate to happiness per se. It might, put you in a position to maybe do things or enjoy things more, but it certainly isn't an equator to happiness necessarily. So outside of your practice, I'm curious, is there something that you're really passionate about personally?
I'm a fitness buff. So I am definitely somebody that practices what I preach. I mean, when you look at healthcare claims all day long, you start to realize, what do they say? 60-70% of healthcare claims was actually preventable, right? So it's like, watch what you stuff in your fat face, right? As myself, I think about that. I'm like, what am I eating? Like, stop eating bad stuff. And I correlate that all the way through the system, right? Like the pain of, what do they say? The pain of regret is bigger than the pain of discipline. And so I look at that and say, if I want that, I got to live like I want that. And so for me, I am an avid worker outer, whether it's usually at sometime before 5:30 in the morning. I go to boot camps. I work out on the beach. If I'm really pressed for time, I literally have a slam ball in the middle of my living room, and we'll do a slam ball workout in the middle. I travel and have traveled for the last decade, 100 to 200 nights a year, and that's never excused. I'm a 7-day-a-week worker outer, and whether it's me in literally a 10-foot space in the middle of the 2 beds in the hotel room, or the gym membership or the boot camp or whatever, I'm somebody that's super passionate about fitness.
Yeah. So what do you think right now with your business? What are you most excited about? What's the biggest opportunity?
The status quo continues to be status quo. So, and we've done the hard work. We were early, I think, in being all in on this type of design. It's starting to catch up speed. And so now we've got, 60 something clients that we can show actual results of. And so I'm super pumped that, things are starting to now, the rest of the world is starting to look at these things. And so when you think of, Amazon and Google and all these employers that are, flying people to get knee surgeries in different spots, like they're starting to do that stuff. So people start to kind of recognize that. And then on top of that, you're starting to see more attention put into healthcare and just how broken the system is. There was a an article in the, I think it was the New York Times earlier this week about a hospital system in Northern California who is now being penalized that they're having to pay like $500 and something million back to employers for overcharging them and knowingly overcharging, right? And so that stuff starts to happen. And so when I go in and talk about what it is that we're talking about and try people to get, hey, do you think that they want to lower your costs? Like, people really sit back and like, it's the first time you've challenged that way of thinking. And so I'm super pumped that we've done the hard work, right? Like people were like, you guys are crazy 3.5 years ago. And now it's like, oh, and now I can show testimonial and I could show client results. And if you give me your data, I could show it to you in your data. So I'm really excited that adoption rate is starting to happen. We've created a little bit of a brand and the talent that we're able to recruit from an employee perspective, like, this millennial workforce and now the younger workforce, they want to work for companies that have a mission and have a vision and have a purpose. And so, anytime I interview people, I start with, hey, you better buy into this process and what we're talking about, because if you just work here for the job, go work somewhere else. Like and so I'm really pumped up about that adoption rate.
Good. And on the other side of that, Lester, what do you think is the biggest obstacle in your business?
Scale.
Biggest challenge? Okay.
Scale. Yeah. Like, my mother gave me the superpower of being able to look in the mirror and really be comfortable with the person you look at. And I would tell you, I'm a terrible operator of a business. Like, I'm a visionary. I'm the tip of the spear. I like getting on stage. I like being a leader, but an operator, I'm not that good. I don't SOP and documentation and blah, blah, blah. And so it's taken me a little while to not accept that, because I knew it, but I don't think I gave it enough credit of how necessary it is and how hard it is. So I think I would have hired much earlier, a team that could document and do that stuff way before. But, when you're putting on the wings on the airplane while you're flying the darn thing, it's hard to kind of think about that. But the challenge for me is definitely around scale and operational excellence. Okay.
Well, and the good thing is there are people that like that and excel at that would gladly take it off your hands.
And, I do I have a professional business coach, and they, it's Michael Hyatt, and they have this thing called the Freedom Compass, and you put, a quadrant, and on the top left, it's things that I love and things that I'm great at. On the bottom, it's things that I suck at and I don't like doing. It's like, how do I hire people to do this? And so when you get somebody interview and they're like, that's going to be my job and 100% of it, and they're like this, and I'm thinking, oh my God, you like that stuff?
Right.
Like, that's when magic happens.
Ding, ding, ding.
Yeah.
That's right. Yeah, just nailed it.
Right.
So if people want to learn more about you or contact you, what's the best way for them to do that?
Yeah, so I'm super active on LinkedIn. We post videos and posts and stuff. So I would say LinkedIn, it's Lester J. Morales on LinkedIn. Our brand of what we call our program is called Transparent Health Benefits.
Okay.
So THB.health is, Next Impact is our company that does the work, but our brand of getting people to understand what are the strategies and how to do it and things of that nature is Transparent Health Benefits. So THB.health. And then a selfish plug, we've launched a podcast like you, not nearly as sophisticated and how many times, but we're on, I think, our 10th episode now. And so it's called Impact Healthcare. And we interview the people and talk about the strategies that are really impacting healthcare. So that's on the website too, thb.health, but it's on impacthealthcare.fm. And it's a take your gloves off, let's talk about the truth type of an approach. So those are the platforms. Yeah, I'm super pumped about that.
All right, nice. Well, good luck with that.
Thank you.
Yeah, Lester, I want to thank you for taking the time to be on the show today with me here today. You've been able to challenge our thinking on a topic that's important to a lot of people, and people aren't aware of what else is out there and their other options. So this was very good. And I want to thank everybody for tuning in to the Confident Retirement Podcast, brought to you by LPF Advisors, where we're seeking to raise the retirement confidence of everyday people to another level, one episode at a time. Thanks, everybody, and we'll see you next time.
You've been listening to the Confident Retirement Podcast with Kris and Mark from LPF Advisors. For more information on them and retiring confidently, please visit lpfadvisors.com. If your ears are pleased and your mind is now at ease, do share the program with your friends and subscribe wherever podcasts are found.